Fridays are awesome. I'm Carl Azus. Welcome to CNN Student News. First up, should Scotland be an independent country from the United Kingdom? Scottish voters will decide next week in a simple yes-no vote. Scotland's been a division of the UK for 307 years, but its independence movement said those days should be over, in part because it believes Scots, not the central UK government, should be able to determine Scotland's future. Also, Scotland has a lot of oil. The independence movement says if it's separated from the UK, Scotland would be one of the richest countries in the world. The UK says Scotland has only 1/10 the oil that the independence movement thinks it has. And Britain's government's been begging Scotland to stay part of the Union, which Britain calls one of the world's most successful unions. There are a lot of unanswered questions. How would this affect Scotland's economy? What currency would it have? Would it stay part of the European Union? All of these will need answers if Scots choose independence. Polls indicate the vote will be very close. In West Africa, this year's outbreak of Ebola virus is merciless. That's the word from the United Nations. Liberia has been hit the hardest. The hemorrhagic fever has killed at least 1,200 people there. Liberia's finance minister says his country's at war with an enemy it can't see. The nation's healthcare system can't handle it. Efforts to stop the virus from spreading aren't working.
Here's the way it's supposed to work. For every Ebola patient, healthcare workers are supposed to keep track of every single person who's had close contact with them. If one of these contacts gets sick, he's supposed to be isolated. Then all of his contacts are followed until there are no more sick patients. It's called contact tracing, and it's pretty simple, but it's powerful. It helped put a stop to SARS and to smallpox. But in many parts of West Africa, contact tracing is breaking down. These slums are a big reason why. In many parts of West Africa, streets have no names, people have no addresses, there may not be maps. That means some contacts never get found. Here's why that's such a problem. A missed contact can spread Ebola to other contacts, and they'll be missed too. That's why the CDC says even one missed contact can keep the outbreak going. By now in West Africa, there are entire chains of transmission that are invisible. The computer databases that keep track of all these cases and contacts, often they're not in such great shape. One disease detective from the CDC working in Sierra Leone, she says the database there was in shambles. The CDC has designed special software to keep track of these cases and these contacts, and they're trying to implement it in West Africa, but even that hasn't gone smoothly. All of this is starting to add up, and it has the World Health Organization really concerned.
Just the facts. Heroin is a highly addictive drug. It's illegal for private use in most countries, including the U.S. The National Institute on Drug Abuse estimates that about a quarter of those who try heroin once become addicts and become more likely to die from an overdose. Withdrawal symptoms are intense and last for days. They include body aches, vomiting, insomnia, and intestinal problems.
Now, despite that, heroin use is rising in America. The U.S. Attorney General calls overdose deaths from heroin and other painkillers an urgent public health crisis. Communities in states from Virginia to Ohio to Louisiana are trying to fight a heroin epidemic. It's not just that one substance, it's other opiates like it. And man-made drugs like codeine, oxycodone, hydrocodone, stuff that's commonly prescribed for pain relief, these all have similarities to heroin, and they all share the danger of addiction.
How do these chemicals affect the brain? One big way is by exerting powerful pain relief to the rest of the body. Chemicals flood the system and latch onto millions of opiate receptors peppered throughout the body. Think of opiates and their receptors like puzzle pieces. When they bind together, pain signals are dulled, or they go away altogether. If the brain already has opiate receptors, doesn't that mean it can naturally provide pain relief? That's right. Feel-good chemicals like endorphins are natural opiates that dull pain and also give you a rush. The problem with man-made opiates that mimic endorphins, take too many and they can overwhelm the system. give you too much of a rush. That can lead to dependence or abuse. Addiction becomes an even bigger problem because opiates also slow down breathing and heart rate. Mix them with other things that slow down your body, and everything could grind to a halt. In fact, every 19 minutes, someone dies of an accidental prescription drug overdose. Most of the time, it involves an opiate. It's now more common than dying in a car crash. If you want to avoid that fate, don't take more than you're prescribed. Don't use other people's prescriptions. Never mix opiates with alcohol. And maybe try other ways of alleviating your pain, like over-the-counter pain relievers and good old-fashioned exercise.
When Dr. Leela Hazza was a kid, her father told her that he used to hear lions roaring when he slept on the rooftop of their family home in Egypt. She never heard it. When her father told her it was because lions had gone extinct in Egypt, Hazza knew what she wanted to do with her life.
60 years ago, there were probably 500,000 lions in Africa. Today, there's less than 30,000 lions in all of Africa. If we don't do something soon, there are going to be no lions left. Maybe in 10, 15 years, who knows? I spent a year living in the Maasai community to understand why people were killing lions. It brings a huge amount of prestige to the warrior, and they were killing lions in retaliation for livestock that were killed. They started opening up and telling me stories. That's when it clicked. If we want to conserve wildlife, we have to integrate communities. Our organization hires Maasai warriors, and it converts lion killers into lion guardians. Kuna letter mbili. When we first hire lion guardians, they don't know how to read or write. We provide all of that literacy training and technical training. They track lions so they can keep very accurate ecological data on lion movement. The Lion Guardian model is founded on Maasai cultural values, and it is just being tweaked a bit to the 21st century. We never really even imagined that we could transform these lion killers to the point where they would risk their own lives to stop other people from killing lions. When I first moved here, I never heard lions roaring, but now I hear lions roaring all the time.
There's one place we go to find roll call schools, our transcript page at cnnstudentnews.com. 3 schools from yesterday's transcript: Moundsville Middle School in Moundsville, West Virginia. Good to see the Trojans watching. Heights High School in Wichita, Kansas. We've got some Falcons on the wing. And Lowry Freshman Center in Allen, Texas. Welcome to all of the Eagles in the Lone Star State. NBA star Jeremy Lin likes a good prank. His wax figure recently appeared at Madame Tussauds Museum in San Francisco. Except it wasn't wax at all. The 6'3" point guard recently posed as a solid object. Then when people approached, boo! It looks so lifelike. That's 'cause it is. What's cool is that once these people got over the initial jolt, they got to hang out with Jeremy Lin. Assuming they didn't make a fast break, they didn't dunk out, they weren't total basket cases, and they were able to rebound afterward. The prank nets a lot of attention. That's kind of the field goal of it, whether Lin's victims like it or not. I'm Carl Azus. That's your Friday show. We all wish you a great weekend, of course.